So good afternoon, everyone. This is Dr. Chellam and Marina from Holistic Icon. Welcome to our podcast. And this afternoon, we were going to talk about depression, and very similar to anxiety, but still a little different, because depression is the other spectrum of anxiety. Mm-hmm. And obviously, one of the things that we like to discuss is there another approach to depression besides just taking a whole bunch of antidepressants, and should you be taking antidepressants at all? And we'll get into all of that. So I think before we start off with that, I think it's very important to understand what is depression. There's a difference between depression and grief, and we have to really address that first. Because a lot of times when you lose somebody very close, like a parent losing a child, that's grief. That's unbelievable grief. Or you lose a spouse, that is grief. And we sometimes tend to confuse between grief and depression. Grief can last a very long time depending on how big the blow is and how unexpected it is. Whereas depression is where there is no bereavement. There is nothing that's triggering it off, but this feeling of sense of hopelessness and helplessness. And almost a lot of people struggle with even suicidal ideations. That's a very severe form of depression, and there are mild versions of the depression. So anytime you struggle with helplessness and hopelessness for over 2 weeks, or intermittently for at least a 2-week period, and you don't have a trigger that could have brought that on, that is nothing that's stressing you to feel that way, you just wake up feeling that way, it's defined as depression.
Is there like a situational depression?
Yes.
Subset?
So it's a situational depression. So the very first some people are more prone to depression than others. Mm-hmm. There is a genetic trait, and there are other factors which we will talk about in a minute, but sometimes there's a strong genetic trait. So the very first episode or major depressive episode can always be preceded, or usually is preceded by an event.
But then it persists.
Then it persists, or it refires. It's called the kindling. It keeps happening over and over again, and you don't know why you're depressed. It's like, this happened 25 years ago. I got divorced. I was really unhappy at that time, and then I've been doing well, but I don't know why. I just feel depressed. That's the kindling of that feeling of apathy or feeling of hopelessness, and I think that's what is defined as depression. So why do people have depression? Here's what I would say from what I have seen, especially having learned the functional medical approach. There's so much to learn from the function of the body, function of the cells, but here's what we know. Without a full assessment, somebody should never be put on antidepressants for the rest of their life. This is something that I want really well understood. Yes, some people do need antidepressants. They need to get to it at some point, but we always have to look for the root cause. So we have a lot of biochemical changes that can happen. You got to look at, number one, the patient's genetics, number two, their gut, and their hormones. If we don't address all these three and put together, just giving somebody an antidepressant, and then when you look at the antidepressants, when you really look at the history, majority of the antidepressants work in the first few months, but in 2 years, almost greater than 50% of them do not work. People are either increasing dose or adding new medicines or changing, going for a newer one, and that tells us something about medications not being the solution. So depression should be considered not as a separate entity, but a symptom of an underlying problem. And our job should be, as we treat the symptom, as with anything else, we got to dig and find out what is the true underlying problem that's causing this person to feel depressed and helpless. Does that make sense?
Makes sense to me.
All right, let's see if it makes sense to anybody else who's listening to us. So let's get into the nitty-gritty details of how would you approach depression in a different way. I think everybody understands in the traditional way, you go to your primary care doctor, you tell them that, yeah, you are hopeless or you feel helpless. But again, I have to mention here, guys, when you have a true grieving situation, let your primary care know and be very realistic about how much time it takes for you to get over that particular loss, whether it be a loss, like I said, of a parent or a child or a pet. There's a grieving period we all have. That's not a period to be treated. That's not a period to say, I don't want to feel the sad. You got to feel sad because that is the natural, it's like the catharsis of whatever that loss might be. But I think a lot of people go in erroneously and say, I've been depressed since my father died 2 years ago. Mm-hmm. But that may need a little more. Maybe you need therapy in addition to some support. But let's look at what are the things you have to really address before you get into it. So as you know, being a functional medical practice, we always look at the 5 pillars of health, and one of the commonest pillar is nutrition, right?
Yeah, it's a big one.
It's a huge one. Yeah. 86% will be probably your nutrition. Mm-hmm. But here's what you also have to remember. If there's anything else, I want you guys to read I posted something about the biology of belief by Bruce Lipton. A lot of the things about our cells is how healthy our thought process, our thoughts really determine our health. So a lot of times we have to look at what are we feeding our cells. The commonest few things that we can actually directly have seen a correlation between how we can get depressed or angry or upset will be, of course, insulin resistance. The highs and lows of sugars,
like
right?
An underlying theme in these podcasts.
It's an underlying theme in our health. Mm-hmm. So sugar, if it goes high and low, you are going to have those mood swings. So one is insulin resistance. The other would be also the lack of the right kind of amino acids, which produce what we call the neurotransmitters. Neurotransmitters are the chemical substances that allow our nerve cells to speak to each other. Now they come from amino acids, and amino acids are the breakdown of protein. And we have the 2 important amino acids we talk about is tyrosine and tryptophan. Tyrosine goes on to form dopamine and norepinephrine, and tryptophan goes on to form serotonin. So what we really need to see is how does the tyrosine, when you eat some food, how does it get to the brain to become a neurotransmitter? That's the other big barrier that it has to go. Mm-hmm. So tyrosine is actually formed in the liver. It's a conversion of the phenylalanine to tyrosine. So that requires a certain number of enzymes, vitamins, and minerals. And if you have a deficiency of any of those vitamins and minerals, you don't make tyrosine.
Which means nutrition.
Nutrition, yes. There could be absorption also, digestive process mm-hmm. too. You can eat all you want, but if your digestive process is messed up, you probably would not be able to absorb them. Of course, the right nutrition, making sure digestive processes are good. And then the next step is the tyrosine needs to get into the brain for it to become a neurotransmitter. For that transition to happen, you need to have good function of the insulin. Mm-hmm. And when the tyrosine gets into the brain, then again you have the vitamins like you have oxygen, iron, vitamin C, the B complex, especially B6, and that gets converted to the L-DOPA, becomes dopamine, dopamine becomes norepinephrine, and at every stage there's a certain number of B vitamins that you need. People would have heard of a product called SAM-E, which a lot of people buy that, but they don't know why they buy it. It's because it helps with the production of smooth transition of these neurotransmitters. Now, tryptophan, on the other hand, was another amino acid that forms serotonin. Also, if there's an imbalance there, you can land up being very depressed. Now, high serotonin makes you very sleepy, which is what we see after the turkey dinner, right? Yeah. We spoke about it during anxiety. But here's what you need. First is digestive process. Now, what affects our digestive process? Obviously, the gut bacteria, and of course, having the varied foods. A lot of us, we are creatures of habit. We eat the same things over and over again, and so we're never well nourished. So you have to look at your nourishment. You'll have to look at your digestive process. You'll have to really look at the vitamins and minerals before you say, all I need is an antidepressant.
Right. There's a lot of underlying factors, and antidepressant is really kind of like your Band-Aid for a minute to help you to get to where you need to be, but it should not be a long-term thing. Long-term, you really want to look at what else is going on, because you can't be on antidepressant forever. It's just not going to work for you.
It never does. It usually doesn't. And so what has happened is more recently we have genetic testing of the medications to see, hey, which medicine works well. What do you metabolize? What actually works? Where it's a newer approach. It is a lot of times it works, a lot of times it doesn't work, but a good majority of the time when people say that antidepressants do not work, that's another option if they have addressed all of these other other factors like the digestive process, your nutrition. But also we have to take into consideration your genetic trait. When you have a genetic trait, you have what we call the frailty gene. You may be more at a higher potential for depression. But I've also seen people who have the genetic trait be very happy because you can bypass. Remember, genes are just information. That information needs to get translated, and for it to get translated, your environment should be conducive so that, the wrong genes get translated, then you have depression. But let's talk about the modifiable things that people can do before they decide, I think I need a medication. Number one is managing the sugar intake.
Yep. That's huge.
That's a huge one. The other one is caffeine. In fact, people who are depressed, if they are drinking a lot of coffee, all they need to do is wean off the caffeine. You'll be amazed at how much the mood actually picks up. And, it sounds counterintuitive. I'm depressed. I need something to kick me up. But actually, caffeine brings you down really bad. So that's another one. And then is there anything else that from a diet standpoint, I think I had taken some notes, let me tell you so I won't forget, alcohol. Alcohol, I never remember alcohol because unfortunately I don't drink. I miss out on a lot of the fun. But alcohol can actually, initially it gives you that high, but then it really gets you down low. And when you are a chronic drinker, you actually tend to be more on the depressive side because it depletes you.
Right, exactly. It depletes your nutrition too, which is a big thing. So again, when your nutrition is depleted, everything goes down. The same thing when you have a triggering event, your mood goes down, all these things go down, your body's trying to fight it, cortisol goes up. Cortisol is another big one too, it's depression.
Yes.
So over a period of time, your body just becomes depleted and it cannot make the amino acids or get them to where they need to be for lack of nutrition. And so no matter how many antidepressants you take, you're nearly never going to get to that point where you want to be unless you fix all that other stuff.
Right. And sometimes counterintuitively, again, when we are depressed, what do? We feel good when we eat a tub of ice cream or a whole bunch of chocolates. So for that moment you feel good. Right? There are some people who respond to it, but it's a short term. It's like a big high, like having the cocaine and then
an addiction.
And then and you just drop down. So you have to be cognizant of how your mood varies with your nutrition. Now, as far as the things that you can alter, obviously one was the diet and the other is the caffeine and the alcohol intake. And then, of course, we want to introduce another very important and easy thing that you can do, which is exercise.
Yep.
Anybody who exercises actually finds their mood does or change, and they do feel a little more happier. So if you're one of those who's almost like a couch potato, try to get up and move, which is a little harder when you are depressed to get the motivation to do something. This is where you want to partner with someone who can actually take you out. We tend to isolate ourselves when we get depressed. And getting that one person who's reaching out to you, getting them to help you get out or get into that, take that first step to just exercise. that will alter your neurotransmitters too. And really, studies have shown that it is as good as taking a medication, regular and daily exercise with the right kind of nutrition. So,
yeah, and getting outside for the exercise too actually makes a huge difference. So if at all possible, get outside. Trees are good.
Sunlight.
Yeah,
absolutely. Nature is very good. Walking outside, and then of course, I guess hanging out with the right people who have a positive mindset. But a lot of people who are depressed do tell you that they just don't feel like doing it.
Mm-hmm. Yeah.
And if you have that insight that you don't feel like doing it, all you have to do is, the first step is the hard step where you have to get yourself out and get that help, or just seek professional help. I'm sure we also see that psychotherapy, a lot of the studies show psychotherapy works very well in conjunction with the antidepressants. So again, very important to make sure that you identify that you have depression and also address it with all of these. I see that a few of our regulars are here. Hi, Diane. Hi, Pam. And Rosalie. Hi. Hello. And I'm going to also pull up a few other things that we spoke about, the dietary factors. There's a few other things that I want to talk about is the sweetness. When you do on a regular basis sweetness, it does a few things. They really think it either shifts the gut bacteria or they inhibit the absorption of tryptophan. Tryptophan is one of the amino acids that makes serotonin. So make sure you don't buy things with sweetness, especially the aspartame. And then you have the monosodium glutamate, which is the MSG, right, that we see a lot. Sometimes people have noted with MSG there is severe depression, which is very interesting. We talk about this all the time. Soy and MSG, which is used in the Asian countries very often. In fact, MSG, a lot of Chinese cooking has nothing but MSG in China. But somehow here we react to it, and I think it's just the way these things are processed. Mm-hmm. And they're probably, again, altered and create more of a problem for us than actually the benefit that people in the native, where these foods are native to, they seem to actually benefit from them and we get hurt by them.
So we take all these foods and we process the crap out of them.
That's
call it the same thing.
Yes. And I think that's the thing. It's our regulations and how the food gets altered. So let's talk about the few other things. So when you go to a doctor and you say, I want a different approach to manage my depression besides medications, what are the things that they tend to look for? And that's what we have to look at too. One of the commonest things which we see in our practice is food sensitivities.
Yeah. Mm-hmm.
Particularly gluten has really been associated a lot with depression. Then milk.
Yep, dairy
mm-hmm. products. We find that when if you're not able to process these foods and you react to these foods, you actually create a lot of mood disorders with them. So looking up food sensitivities.
Right, and with food sensitivities too, it's not just simply a food sensitivity, but it changes your microbiome and it increases inflammation overall, especially in your gut, and then it goes everywhere else. So it's like, it's not just one thing, it has this sprawling effect throughout your body, and the microbiome has just been shown over and over again to have so many effects, especially on mood.
Yes. And that's very important to understand. We always talk about the gut microbiome. So these are the critters in your gut. So it's almost like 16, 17 trillion bacteria, and we have much less genes, right? And the simplest way I'm able to put it to people is we have the good, bad, and ugly in the gut. The good is the one that protects us, gives us the vitamins, helps us with the hormones. And the bad and the ugly are there for a balance. But when that balance gets upset, what happens is we don't get a lot of our hormones and neurotransmitters produced as effectively. And we have seen, and especially with a lot of the rat experiments, when you change the gut microbiome, you actually shift the mood of the animal. Mm-hmm. And we think the same thing, similar stuff happens to us. And we have noticed also here, as our patients change their diet, their fiber increases, their gut bacteria changes, their mood changes. But if they're still holding on to that sugar, caffeine, and alcohol and everything else,
the processed food.
And the processed food, it's just a longer journey to get better. Mm-hmm. So our goal should be to alter the gut bacteria to benefit you rather than harm you. That's one of the things that somebody who is in functional medicine will work on. So changing your diet, looking at your gut bacteria, seeing what needs to be shifted as far as that goes is probably one of the biggest testing besides the genetic testing that we do. And then we look at the B vitamins because B vitamins are required throughout the production of the neurotransmitters. We look at the amino acids, L-serine, tyrosine, the glutamine, inositol, carnitine. There are so many of these breakdown products that we look at which will impact the production of neurotransmitters, and make sure that you have an adequate, a good dietary program that not only stabilizes your blood sugar, gives you the good complement of amino acids for the production of neurotransmitters. Your genetic testing, particularly what is called as MTHFR, it's the methylation trait that we look at to see if the B vitamins are well activated. And one of the blood tests we look for is homocysteine. If you have a high homocysteine, the chances are your MTHFR is not being bypassed, that particular genetic trait. What are the other things that we actually see with our patients before we go into what are the treatment modalities, or are there any alternative treatments that we can render besides just antidepressants? Is there anything else we see with our patients other than their diet, lack of exercise?
I will say, it's really amazing how much relationships play a role in all of this too. So, you don't want to discredit that portion of it too. Is really your surrounding, your environment, who you're around.
I think that's a very good point because they see this actually, the brain waves change. So if you're one of those that chronically complains and you hang around complainers, you hang around, some people are so good, the minute you give them a situation, you can be excited as you want. They will immediately see the negative in it. They can pick it out. It's like, what are the 10 things that can go wrong in this situation? And that's
they
how
maybe don't mean it, but that's how it is. Yeah.
They don't mean it, but they're wired to see. That's the caution in them. And then what happens is when you hang around people who just build that negativity, as basically our brain helps us protect, it kind of protects us in every situation. And that's a normal knee-jerk reflex for us when we see a new situation, is all the things that can possibly go wrong. Number one, you have to learn to fight it. It is a conscious conversation you have with yourself. Number two, hang out with people who only can see the glass half full. It's a little harder, but even those people have trained themselves to get to that point where they look at some situation and all they can see, even through the problem, is how much good that's going to come out of it. And that's the kind of people you should hang out with, because when you hang out with, I say this always, when I used to go to the assisted living where one old lady might sitting at the dinner table, say, oh my God, my hip hurts. And she's trying to gather all the sympathy. And then the woman next to her says, oh, only your left hip hurts. My right hip hurt too. And then the third one says, you don't know, I've replaced all of this and now my shoulders hurt. And they just build it up and nobody's feeling any better. Yeah, if at all anything, they were trying to one-up each other to see who is in a worse situation. So when you go to a friend and you're telling them, I feel so depressed, this is what is happening, if they tell you about their depression, that's not a good match. They should be helping you see the positive side of the situation, because every situation has a positive side and has a negative side. Even the most negative things can be turned around. So it's extremely important to see who you hang out with, who are the 5 people on a daily basis you come into contact with. If they're bringing you down, maybe it's time to find new people. I don't know. Anything else that we have, and as far as the environment goes, before we get into what are the alternatives besides medications that they can do?
Just to, clarify again, you have a trigger, something happens, and we have so many times people are like, oh, well, this happened to me 10 years ago, 20 years ago, and these things do build on themselves because their root cause was never addressed. Because when you have that trigger, you do have a decrease in minerals and nutrition and vitamins. Everything in your body just doesn't work as well. And so when you continue to have that situation without ever doing anything about it, then it's just going to progress and get worse. And that's kind of when people find us, is at that point.
And, to answer that a little more clearly, so I had a patient who came in this morning and she said, so are you telling we don't treat the symptoms, we just work on the underlying cause? No. We treat the symptoms, but as you're treating the first symptoms, you look for the underlying causes and you look for the underlying imbalances. I never say don't take a medication. Somebody is suicidal. You got to do something to stop, put the brakes there and get them to not progress further in that direction. But at the same time, that is not the solution. That's just like, I'm going to hold this in place till you fix. It's like putting a crutch till you fix. But the problem is it's like telling a child that falls, who's learning to walk, you fell here, hold on to these crutches and walk for the rest of your life on crutches.
Yeah.
You help the child, you give that walking toy, but you eventually make sure that the child learns to walk. And that's what we have to do with all disease processes. You can give a crutch, which might be a medication short term. Ideally, antidepressants were really introduced to give you a 6-month relief as you work on the underlying depression process. People take it for 20, 25 years now and still are depressed, still walk around saying, I have depression.
And they have anxiety, and then they have all sorts of other things.
Yeah, then it evolves into other things and the best way I would say is this is the way you would look at it. Say you have depression, right? And depression in our eyes, in the functional medical eyes, is a symptom of an underlying problem. Let's say the underlying problem is gut inflammation because recently you ate something that wiped out your good bacteria in the gut, and therefore that
antibiotic,
maybe an antibiotic, whatever it may be, and you have an inflammation, but you have depression, so that's a symptom. You take an antidepressant, so that symptom gets better, but you still haven't fixed the problem in the gut. Now the body is saying, hey, you know what? I gave you depression to make you understand I have a problem in the gut. You just suppressed my symptom. You just suppressed my cry. You just shut me down. So I'm going to give you a new problem. So then it goes and starts giving you a headache. Then you take a headache medicine. And you walk around saying, I have migraine headaches. You take a medicine for migraines. And then again, the body is saying, I try to create a problem. I try to get attention to the problem that we have, but then again, you've suppressed the pain with a medication. Then it gives you psoriasis. So you go get treated. Now you're in an autoimmune state, right? So it's an ongoing problem. Again, you get the light therapy, the cream, or arthritis, and you take anti-inflammation. Eventually, when it gives cancer, you're suddenly looking at it, like, why am I having all these issues? That's when you begin to ask questions. You ask questions the first time when you have depression. Where is the imbalance? And that's what we look at. So we look at the imbalance, change the nutrition, make sure you have the right vitamins and minerals. And it may be something that has to be adjusted till you get to a better situation where your environment changes, your outlook changes, you're a far more healthy state than when the initial event happened. Time is the best healer. So even if you had an initial event, eventually you do heal over a period of time. So that's something to keep in mind. We're not saying don't take medications, but we're definitely saying medications are not the only solution to this problem. Does that make sense?
Right.
Okay. So let's look at what are our natural options. I'm going to have to look at some of the information. Like we said, the amino acids, in fact, studies have shown when people are deficient in these amino acids, you just replace the amino acids, particularly tyrosine and tryptophan. A lot of times the depression really gets better. And then we have the botanicals. There are 3 ways to look at any evidence in terms of treatment or alternative treatments. We call it A, B, and C. A means it's completely been shown 100% through studies, randomized controlled studies that this thing works. For example, acupuncture for nausea, vomiting works. That's a grade A. Mm-hmm. Grade B is where mostly it works. We have seen it. It's not consistent, but most patients say, you know what, this works, like ginger for digestive issues. Most patients say, hey, it made a big difference, so we think That's a grade B recommendation. And grade C is anecdotal. It worked in my patient, therefore I think I'm going to use it as an option.
Essentially, there's no studies that have shown
There are no
it.
studies, yeah. So A and B recommendations is what we try to stick to. So it means most of the times these things actually work. St. John's wort has been well studied, but then there are other issues because most people don't have only depression. And St. John's wort really interacts with a lot of our medication. So you have to be very careful. You have to take it really under the guidance of a provider or an herbalist if possible, somebody who understands these botanical herbs. The other one would be the ginkgo. The ginkgo, again, a Chinese herb, is really being shown to stimulate and alleviate depression. But again, you don't want to give it in the elderly. Sometimes they can, if they have an underlying dementia, you can actually create a lot of aggressive behavior too. So you have to be very careful. Again, like I said, herbs have to be done. I know you can buy a lot of these things over the counter, but you do need to work with a provider who can help you and guide you through this process. The other interventions that you can do is, besides the diet and these botanicals, I know there was something I am missing here.
Intravenous B12?
Oh, the B12s can be given as IV therapy. I think it's called Myers cocktail. They put in the C's and the B's together and they create a cocktail which you can get as IV therapy. That obviously has to be done in a specific place that does these and then the B vitamins in general. You do the B complex, but it'll be good to check for B3, B6, B12, and the folic acid.
So if you're having some absorption issues, that's a good route to go.
Yes.
For some, kind of.
If your gut, if your gut is still inflamed, doing IV therapy is probably the better way to do. But you have to do almost 3 to 6 treatments rather than just do one and say I'm done.
Or it didn't work. Like these things take time; they have to build up.
And then this is something also keep in mind, guys. When you come in with a history of depression for 25 years, or you have a certain behavioral issue for 25 years. In fact, when you see depression that's chronic, it's called learned helplessness. Remember, I said depression is a sense of hopelessness and helplessness. Mm-hmm. But when depression comes over and over again or recurring, it's called learned helplessness. That's why biofeedback and psychotherapy are so effective. And you really need to find the right psychologist who can get you out of it. If you've been seeing your psychologist or your doctor or even for your internist for that matter with the same problem for 25 years, nobody's actually fixing the issue. They're just helping. You're living with it. They're letting you live with it because they don't know any other option. So these are things that you should be able to overcome. The other things that we have to talk about is magnesium. Magnesium is low in a lot of people with depression. And I think the way you look at the magnesium deficiency, it's very interesting. They say just like iodine deficiency, you literally have to give them a loading dose and then check the urine and see if they pee out the magnesium. If they pee it out, then they don't need it. If they don't pee it out, that means they absorb all of the magnesium. That's how you see truly magnesium deficiency. But since that's not practical to do it, we just recommend people taking a magnesium supplement. Then, of course, the chromium and zinc is very important. Zinc is extremely important for the production of a lot of the neurotransmitters. You have to look at the copper levels because even low copper can be a problem. Low iron can be a problem. Vitamin C deficiency can be a problem. So we look at all of these vitamins, minerals. You can't just go and blindly take them. Sometimes you're just shooting in the dark. It doesn't take very much to do these tests. All you have to do it once and then have a good evaluation. And usually the solution is long-term because one of the goals should be you should be taught how to take care of yourself. You should know your triggers and you should know your thinking pattern and how to break that thinking pattern. That's what we have to work towards. Mm-hmm. And then I think there are a few other recommendations. Acupuncture does work in some people. Again, everybody is very different because it's again how what is actually your problem? Is it your gut problem? Is it a genetic trait, a methylation problem, which means your vitamin Bs are not working? Is it a problem with your enzymes? Your enzymes, genetically are not as strong to do the conversion of all of the amino acids into the neurotransmitters. And then there are a few other things which are not necessarily well studied, but I will go over this. These would be, I did tell you about psychotherapy, Jay, saying what? SAMe. SAMe, adenosylmethionine, is something, it's when the methionine gets converted to homocysteine, this is SAMe product that gets formed. It's an intermediate product. It's extremely important in the production of the neurotransmitters. If you don't have enough production of that, you tend to have not enough neurotransmitters and a lot of depression. So that's another supplement that is recommended. These are all grade B recommendations. The grade A recommendation is actually St. John's wort, believe it or not.
With that one, though, too, if you are taking medicines, you have to be careful because they
interact.
They work on the same process. So that's the thing with herbs is they are medicinal, and so they target very similar processes that medications do, and then you would overdo it.
Correct. So that's something to keep in mind. Of course, physical therapy is extremely when I say physical therapy, physical activity.
Oh, yeah.
Yeah, sorry.
That makes more sense.
Yeah,
like, oh,
physical.
This is new.
No, physical activity is what I meant. I misspoke. It's physical activity is extremely, psychotherapy and physical activity. Mm-hmm. The other thing is yoga really actually works for a lot of times. Now, what we find is the mind is very fast and our body is very still in general. Right? We're constantly, thought processes are going, but we're sitting for 8-9 hours in the day working. What yoga does is just the opposite. It calms the mind down and increase your body's activity. And that shift also helps with depression. So breathing helps with changing the oxygen. A lot of the neurotransmitters need oxygen, and just taking deep breaths can shift the cortisol levels, shift your sugar levels, and also create a little more relief of any anxiety that's associated with depression.
Yeah.
And as far as the other stuff that are not necessarily well studied, but people have used, is the aromatherapy and music therapy, art therapy. There are a lot of things that stimulate the creative area of the brain and really decrease the negative aspects of our brain. But again, these are all things. Any one of these, whether it be exercise, whether it be your diet, whether it be vitamins, it's all about consistency. What you consistently do, you will get results for. So if you're consistently brooding, you are going to have always that more of a depressive attitude. But if you're consistently nourishing yourself and you are exercising and you actually put in a lot of time into self-care, depression is very easily managed without medications. It's just something to keep in mind. Anything else that I haven't covered in what people can do?
Well, if you guys have any questions, you can go ahead and type them in. I'll just tell a little story because this is all like so very multifaceted. So if you just do one thing, like you just do B vitamins, most likely you're not going to get the result. It's usually diet and supplementation that has to go together. So it's usually a couple of different things that have to happen to really get results in the long term, and you have to do it for a while. But we actually have a really great gut detox that we've done with people who specifically suffer from depression and anxiety. And in 6 weeks, just the turnaround was amazing for them.
It is. It is actually, it can be very life-changing when suddenly your gut clears, your brain fog clears. So nutrition is very important. The digestion is very important. And then there are other things also to keep in mind when you just said about the change is for people who are on a lot of antidepressants and still feel depressed, you really need to get your genetic testing done. Mm-hmm. And without that being done, and we're not talking about 23andMe, it really gets something that is going to be read by a professional. And like I said, if you're on multiple medications, get the genetic testing done. A lot of psychiatrists can do these genetic blood testing to see if these medicines are appropriate for you, but also check your genes to see if you're prone to depression, severe depression. So that's something to keep in mind also. Okay?
Yeah.
All right. So as we wrap up, what are we going to talk to people about food as medicine at this point?
Yeah. So you briefly mentioned vitamin C as one of the things that can help with depression. So people who are deficient in vitamin C, that, vitamin C doses do help. One thing to kind of understand about, I guess, our daily recommended intakes of these vitamins is that they're really created to prevent disease, not to promote health. So you can be in the normal range for these vitamins if you're doing just a regular blood test, but really for yourself, you're deficient in terms of really functioning properly. So we really have a much higher threshold of how much of these vitamins that we need. And vitamin C is one of those where the RDA for it is like to prevent scurvy versus how much you actually need above that to really promote health and wellness and proper metabolism and for all these neurotransmitters to work properly. So vitamin C actually plays a role in the synthesis of serotonin and norepinephrine, which are your little feel-good neurotransmitters. So they did a couple of studies in 500 milligrams 2 times a day, all the way up to, I think they were doing like 1,800 milligrams. So it's a wide range that they've done studies with. But yeah, so vitamin C is actually really high in rose hips. So you can do rose hip tea is one way to get it in. Yellow peppers, chili peppers, black currants, thyme, parsley. There goes your herbs. Having your herbs in your food is huge. Kiwi, broccoli, Brussels sprouts, lemon. That's the one that they were using way back in the day to prevent scurvy and to reverse scurvy. So I think the RDA is about 90 milligrams. They're saying around 500 is really what you would need to overcome a deficiency. So strawberries, for example, in 1 cup, there's 89 milligrams. In lemon, 1 squeezed lemon, there's 77 milligrams. So just having these things in your diet, overall just having a high fiber diet to kind of get at all of the things and the microbiome and the vitamin C and all the other nutrients. But if we want to focus on vitamin C today, there's plenty of things that have it, increasing that fiber, increasing your strawberries, there's kiwis, broccoli. Didn't really think about that one probably. Brussels sprouts,
Broccoli,
kale.
magnesium too.
Yeah, kale has a lot of both of those actually as well.
And as you spoke about vitamin C, I wanted to also add omega-3 is another one that people go back and forth for depression. The studies are very confusing on omega-3. They found that 1 gram works and then 6 grams sometimes work, but in 3 and 4 doesn't work. So again, I think anytime you take supplements, it's better to work with somebody who knows about these supplements and actually puts you on the right one so we can see results rather than just blindly walking down the aisle in Whole Foods or anywhere else and just picking up something that and asking the person who stocks these things, hey, how much should I be taking? It's like having the doctors learn from the pharmaceuticals sales rep how to give the medications. That should not be the way that we learn it. So it's the same way. You really want to truly understand the science of these herbs or supplementations. And remember, they are supplements. That's why they're called, otherwise they would be called as food. They are just supplementing to what you're already doing. So supplements work best when your nutrition, your gut is actually good and your environment is actually good too. So we have to, the vitamin C was a very important part, but keep in mind omega-3 is another supplement that has been studied with depression.
Yeah, it's just not about supplements, because if you're just going to go and, like you said, off the shelf, take a bunch of stuff, you're probably not going to get much benefit. But even starting your day with either lemon water is a really good option, or doing a smoothie with strawberries and lemon and what's another one, kiwi you can throw in there and some kale. Just get a bunch of nutrition in right away in the morning really might help elevate that mood. So that's one way to do it. And work on that microbiome.
Work on the microbiome. So to just summarize, guys, when you have depression, long-term treatment is not just medication. Look for the root cause. Look at your genetics. Look at your gut health, which includes digestion as well as your gut bacteria. Look at your liver health, because a lot of the processing happens in the liver. If you have a fatty liver, it's a little slower in processing these things. Look at your insulin resistance. And of course, we forgot to mention the very most important hormone, my thyroid hormone.
Your favorite.
Yes, we are transforming your thyroid. So the thyroid is being very much associated with severe depression. So you should get your thyroid definitely checked. And we never do depression treatment without checking the thyroid and B12 levels in people diagnosed with depression, especially if they're older and don't have a history of depression. And then, of course, when you're looking at the management, not only changing your environment and your relationships, hang out with people who are positive, eat food that is nourishing, make sure the gut, the digestive processes are good. So if you're eating a lot of good food and you feel bloated, then you don't have the right kind of enzymes or the bacteria. So you have to work a little slower, work with a professional to get to the right level. It does take time to shift your physiology. You have to remember that. I have my kids, really a wonderful example. Suddenly my daughter decides she's going to eat all healthy, and she's been eating healthy for 2 days now exactly. And yesterday she said, I don't feel any different. Well, it takes years of abuse for us to get a disease state. So it takes at least a few months of consistent good behavior or self-care. When I say good behavior, self-care, care towards self, in order to get the results we're looking for. So, and then of course, simple ways through nutrition, how you can shift a lot of these neurotransmitters is very important. If you have a huge digestive issue, just get IV vitamins. And as always, you can reach out to Holistic and Integrative Center of Novi, which is Holistic Icon. And you can book an appointment, or you can actually give us a call to see how we can help you, or if we can help you at all. Is there anything else before we wrap up?
Nope. Just for the guys who are joining live with us, next week we will be on Tuesday, August 21st at 3:30 versus Wednesday. So next week, Tuesday the 21st, we'll be live. Hope to see you guys there.
All right. Take care. Thank you once again, guys, for joining us.